Okay, guys, so we have a very special session here. Um, one of our family member of the DNA family, Ravikant sir, who is a cardiologist, he has joined us. Sir, are you there here somewhere?
Yeah, I'm here, sir. I'm
Yes,
here.
sir. Hi.
I'm
Yeah. So he's going to speak. Let me introduce him to you. And I'll tell the introduction. I think it was around 3 years before. I went with my mom to his hospital, and my mom was having some chest pain. And I thought it's normal, maybe just acidity or something. But when we went there, sir diagnosed her with some blockages in her heart. And but the way he told, the way he was communicating with me, the politeness, the silent mind. I mean, he was so silent and so polite, so down to earth. It was very impressive. And of course, he took care of my mother in a best possible way. And now she's doing very nice. I mean, she's absolutely fine. So in this way, I know him. I mean, and we are personally connected now. And definitely, I have no problems. I don't have any worries. If I get a heart attack, sir is there for me. Okay. And one more connections I can tell you here is, sir, one of my, not one of my, I have only one best friend, that is Sunil Mari. He is a deputy collector, and he has also joined here. He knows you, I think.
Yes, I know.
You spoke with him.
Yes.
And he insisted that I also want to attend this session. I said, definitely we can do that. We can participate. Sir, I request you, I know you are very busy, but can you give us 1 hour? Is okay with you? Can you give us 1 hour?
Yes, sir. Yes. No
Okay,
issue.
because I know this is very important for everyone. This is connected with our life and death. Though I work on mind, but you work on heart, and mind and body are very closely connected. So thanks a lot for coming here again on behalf of all the DNA family members, sir. And we will start shortly. Rahul, sir, should we start? What is your plan?
Yes, sir, you can start.
Okay, please allow Ravikant sir to share the screen, Rahul sir.
Yes, sir.
Sir, it's all yours. Please start, sir.
Yeah. Thank you very much, Sandeep sir. Actually, sir has not given one more important introduction of mine that I joined his class 1 month back. I wanted to improve my English, the communication skills, and even the. Are you able to see my screen?
Yes, sir.
Yes.
Yeah. We are able to see your screen, sir.
So that was the another introduction. I think I thank Sandeep sir for giving me opportunity to talk to all of you. One more, apology I just want to make, that my presentation is in Marathi, but I'll present it in English because I couldn't get the good slides about the, prevention of the heart disease in English. So I thought I have a previous presentation, what I will present to you. So first of all, I'm very happy to be a part of a DNA family now. Last 1 month, I'm with Sandeep sir, and really it's making a difference in my own communication. That's really helping me. So I thank you, sir, that although I stabilizes heart in many of the patients, you are really stabilizing my mind so that I can stabilize hearts in a better way. That's what I can derive in all these things. So let's go to a topic. What I am talking today is how to prevent the heart disease. All of us know that heart disease is a very, very important factor which is affecting our day-to-day issues nowadays. It has become very common thing, which, if you see 10 years back or 5 years back, somebody has undergone angiography or angioplasty. That was a rarity. Once or twice in a year you used to hear that somebody has undergone angioplasty, he has undergone angiography. But now if you go to every place, every village, there are 10-15 people who has undergone angiography, who everybody knows now what is angiography is, and the person who also knows what is angioplasty is. So the one important thing is the disease awareness is so much about the angiography and angioplasty nowadays. This is only masked by corona now. Before corona, everybody was talking about the heart and heart diseases, but now this is the situation in last 5 to 10 years, that we have moved really into a very, very vulnerable place in heart disease. Let me tell you that estimated heart disease in 2040 is almost 60% of our population. That means today 20% of our population has got the heart disease, and over a period of the next 10 to 20 years, there will be at least 60% of the population which will get affected by the heart disease in one or another way. This is the severity of the issues and the severity of the this heart disease problem which is happening in Indian society, and Indians are more and more vulnerable to that. I'll tell you what are the causes why Indians are more vulnerable for the heart disease, but this is what is the reality, and this is what is we are going to face in next 30 to 40 years. So as Vivekananda always said, that wisdom lies not in the amount of a knowledge acquired, but in the degree of its application. So as a cardiologist, whatever amount of a knowledge I acquire, I treat the patient unless and until I communicate my knowledge to the masses, unless and until I communicate my knowledge to prevent this disease to happen, this disease, then there is no use of my knowledge. So it is very important that even you have knowledge, unless until you apply it to the reality, to the real world, it won't be useful to you. So first of all, I'll tell you what heart is. This is the short video to understand actually what does the heart mean. What is the function of the heart in our body. This is a small video which will show us how the heart functions actually. So all of us know that heart is a small organ which is situated in the center part of the chest. That is, it is situated into the left side, slightly left into the rib cage. This is the first important thing when we talk about the heart. What is heart actually? The heart is nothing but the muscular pump which is located into the center of the chest, that is slightly leftwards towards the chest. And the heart, so just go on seeing this video, you will understand what this is.
Sir, you can share the audio also there. Do you know how to share the audio?
Actually, I don't know how to share the audio, but I can explain.
Ravi,
it's not audible.
sir.
Rahul, can you do that from your side?
Yeah, I'll do that from my side.
No, sir. No.
Rahul, sir, there is an option share audio kind of on the top of your screen.
No, sir. In the screen, Ravikant sir has to enable that option.
No, that's okay.
Share the computer sound.
I will talk about the video. That is better.
Okay, sir, no problem.
Yeah. So as you see this is the whole part. There are 4 chambers of the heart. This is the right chamber and this is the left chamber of the heart. And when you so this is how the heart pumps the blood. Heart pumps, it has got the 4 chambers basically. As you've seen in the video, the heart has got the 4 chambers, one towards the right side, one into the left side. There are 2 chambers in the right side, there are 2 chambers in the left side. What happens in the right sided chamber is all the blood which is desaturated blood from the lungs, blood from the limbs, blood from the brain and liver, kidney, all other organ blood comes deoxygenated into the right side of the heart. Once it comes into the right side of the heart, the whole blood is pumped into the lungs. In the lungs, whatever oxygen we take from the nose, it goes into the lungs, and that oxygen is mixed with the blood in the lungs, and from that the whole blood comes into the left side of the heart, that is left chambers. and the left chambers of the blood cells or the heart wall constitutes all this oxygenated blood, and once this left side of the heart chamber pumps the blood, it goes into various organs into the body. What you are seeing on the screen is the cells or the blood vessels. With the network of the blood vessels, the whole blood goes into the smallest cell into the body. So this is how the blood flows into the complete smaller cells into the body, that is capillaries, smaller venules, smaller vessels. So this is what is actually the work of the heart. So as I've seen in this video, what actually heart does is heart takes out the deoxygenated blood from the whole body into the right side of the heart. From the right side, it pumps into the lungs. In the lungs, oxygen gets mixed with the blood, and from the lungs, it comes into the left side of the heart, and from the left side, it pumps the blood to the whole of the body. So the function of a heart is convert a deoxygenated blood into the oxygenated blood and supply every organ of the body. So now imagine that even for a second, 1 or 2 seconds, if heart stops functioning, what will happen is whole blood which is going into the body organs will stop. So that is why heart is very, very important. Even heart stops for 1 second or 2 seconds, the whole the blood, the brain, which requires the blood vessels or the blood, if the brain does not get the blood more than for 3 seconds, it is a so sensitive organ, so the whole brain will stop. Similarly, if the heart stops for more than 3 seconds, the blood flow to the brain will stop for 3 seconds and the brain will get damaged. So heart is very, very important organ of the body, and that's why we should take care of the heart. And that's why the heart disease, we should not wait that we should develop a heart disease. We should make all the efforts that we should never develop a heart disease. That's why the prevention is important than a cure in cases of the heart disease, because of the importance of this organ into the body. So now let's see what are the different types of the heart attack or the different part of the heart diseases. We all know that heart attack is the only one thing which we understand whenever we talk about the heart. But except the heart disease or except the heart attack, there are various diseases in the body which in the heart which can cause the problem. So most important is the congenital heart disease, the heart disease which is present from the birth. We call that as somebody in a layman language, we call there is a hole in the heart, or the baby has got some mal pumping into the heart. This is what we call. That means these are the diseases which are present at the time of a birth into the heart. That is because of the developmental anomalies. Developmentally, heart has got some kinds of holes, some kind of the different connections into the body, and that makes the patients of a heart disease from the birth. That is called as a congenital heart disease. So there are different kinds of the congenital heart disease. We must understand that 70% of the congenital heart disease are treatable diseases. Anything which is diagnosed during the birth can be treated immediately. So there is no need to worry that if there is a heart disease during a birth or after the birth immediately, what we should do. We should always consult your cardiologist wherever possible, and then try finding the solutions for that. And that is treatable, nothing to worry about that. Then there is another form of a heart disease that is called as the valvular disease. The heart has got 4 chambers, and these 4 chambers has got 4 walls. What is wall? Wall is like from one chamber to another chamber. When the blood goes, there is a resistance or there is a wall between these 2 chambers which regulates the blood flow between these 2 chambers. If there is a disease of these walls, this is called as the valvular heart disease. And this heart disease develops generally from the age of 10 to 20 years of the age. This is the first or second decade of the life we develop this valvular heart disease. We call it as a rheumatic heart disease. Generally, it starts with some kind of a arthritic pain, some kind of a joint pain, and from that joint pain, it transmits. Whenever a child of 5 years to 15 years of age gets the joint pain, we should be very, very cautious to check his heart or her heart, because this kind of a joint pains go and affect the heart and causes the valvular heart disease. Third is the as I told you, heart is made up of the muscles. It is nothing but the muscles which is present into the central part of the chest. So if these muscles get weak, we call it this is as a weak heart. In a layman language, we call this as a weak heart. Heart pumping has reduced. It has come 20%, 30%. That's what we keep hearing, that heart is working only 20%. That means heart's muscles have become weak, and that is actually causing the heart disease because of the low pumping of the heart. That is called as the cardiomyopathies. Fourth is a pericardium. The heart is uh, as I told you, is covered with the one kind of a some kind of a covering that is called as a pericardium. And if there is a disease in that pericardium, then it is called as a pericardial disease. Sometimes it is because of the cardiac pulses. That is, pulses are less. We call it is the heart rate which is less. If the heart rate is 20 or 30, we can call them as a complete heart blocks or the heart blocks. This is because of the pulse rate. Generally, it should be 80 to 100. If it is 20, 30, 40, that causes that disease is called as the heart blocks. And most important, all of us know, is a heart attack. Most of the times we think when patient has got a heart disease, we keep hearing that somebody was eating, somebody was jogging, somebody recently there was a actor who got the heart attack while he was doing the exercises. I think Siddhartha or someone. So that disease is called as the heart attack. That problem is called as a heart attack. So what is heart attack? 90% of the heart diseases, when we talk about the heart disease, is heart attack. That is, the blood vessels which supplies the heart gets blocked. Heart supplies blood to the whole of the organ, but there are the three blood vessels, or there are the three important vessels which supply blood to the heart. So if they get damaged, or if they get blocked somewhere, that disease is called as the heart attack. And this is very, very important disease, because 50% of the patients who develop the heart attack will die on the spot. This is what makes heart attack very, very important disease, or the disease which has to be taken care of, because 50% of them will not survive at the moment they get the heart attack. Out of the 50% who survives, only 50% of them will reach to the hospital. The person who reach to the hospital, only 50% of them get the right treatment and survive. That means anybody gets the heart attack, only 25% of the people survive, or survive with the normal heart. This is what is the situation of the heart attack. That's why this topic, that is prevention of the heart attack, is very, very, very important topic, because of the mortality associated with the heart attack, because of the deaths associated with the heart attack. So let's see now what is heart attack actually, what we call as a heart attack. I'll explain you this video. So I'm explaining you how the atherosclerosis develops into the heart. All of us know that atherosclerosis is a disease of blood vessels. That is, the cholesterol gets accumulated into the heart, or the heart blood vessels. As I tell you, this is, as I told you, this is the heart which has got the 4 chambers. This heart is supplied by the various vessels. You can see this is a one blood vessel. This is called as the right coronary artery, which supplies the right side of the heart. You can see this blood vessel. This is the left coronary artery, which supplies the blood vessels to the heart. So these arteries are called as the coronary arteries. And atherosclerosis, that is cholesterol getting accumulated, can happen in any of these blood vessels. So you can see this is the blood flow. This is the cholesterol deposit. Whatever fat we eat start deposited into this kind of a blood vessel. It just gets accumulated the moment we start eating the cholesterol, and then this is the block, what we call, which develops from 10 to 20, 40, 70, 80%, and it stops the movement of the blood into these coronary arteries. And sometimes when we call the heart attack, what happens is this plaque ruptures. Moment it ruptures, this will occlude the 100% of this blood vessel. So this part will not get any kind of the blood here because artery is occluded here. That atherosclerotic plaque has blocked the blood vessel at this part, and whole part of this is stopped working. You can see this part is not working now. And once this part is not working, that means the heart has got blocked. So this is how the three coronary arteries which supplies the heart, if the atherosclerosis develops in that, it gets blocked. And once it gets blocked, the blood supply to that part of the heart, that is the muscular part of the heart, will stop, and that part will stop functioning. And once that part stops functions, we call it as a heart attack. And that is a very, very serious disease. That is myocardial infarction or the heart attack. So let's understand what are the, how to understand this. I am getting a heart attack, or some of your person who is around you is getting a heart attack. What are the different kind of the symptoms you get when you get the heart attack? Most important symptom is you start getting a chest pain. This is a central chest pain. This is not a right-sided chest pain or left-sided chest pain. On the contrary to the belief that people say that heart attack, if you get a heart attack, you will get the chest pain in the left side of your heart. It's not left side. It is center of your chest. There where you get the chest pain. What kind of a chest pain you have? Somebody is stabbing at your chest. Somebody is sitting on your chest. There is a quite compression on your chest. Somebody is throttling your neck. Somebody is this kind of a pain which you never noticed, which you never experienced in your life. Such a severe kind of a chest pain you start getting. This pain is called as anginal pain. And this pain, we should immediately understand that we are getting this kind of a anginal pain. We call this as a pain, anginal pain. And this pain generally radiates to the left arm, not the left part of a chest. That is left arm. It starts in the center. It radiates to a left side of the arm or the left side of the hand. So this is called as the typical chest pain. Some people does not get the chest pain. There's some people who are diabetic. They are called as the silent MIs. They just get breathlessness. Moment they start walking, they are sitting somewhere, doing somewhere, and suddenly they start getting a breathlessness. Lot of sweating, lot of breathlessness, suddenly without any previous symptoms. And there is no chest pain. This can be also a heart attack. Sometimes people are sitting around and suddenly they become unconscious without any symptoms, without any signs. So this is again can be a heart attack. Sometimes it is just a silent heart attack without chest pain, without breathlessness. You just go on walking and sometimes you feel some kind of uneasiness. You are not able to walk. You are not able to do anything. That can be also a heart attack. This is also one of the symptoms of the heart attack. And sometimes we hear that people are eating, people are doing something. He was eating and he suddenly passed away. This is also can be a heart attack. That is death. That is also 20% of the heart attacks can have a sudden cardiac death. This is the symptoms of the heart disease. This is, I was talking about the symptoms of the heart disease. So I'll just run through this and we'll go to a prevention part. So what should we do the moment we get this kind of the heart symptoms? Moment you get a chest pain, moment you get a left arm radiation, some kind of a breathlessness, you are not feeling well. So these kind of symptoms, most important thing you should do is ECG. You should do an echocardiography, stress test, and angiography. These are the different types. Whenever you have an issue, this kind of problem, immediately go and consult your doctor nearby, whoever available. Do your ECG. If ECG is not, if your ECG, if there is a chest pain, if there is a heart attack, the ECG is the first one to get the diagnosis. So that means ECG is normal. Your 50% of the work is done. That there is no heart disease. But there is a but in this. Sometimes even the ECG is normal, you also can have a heart attack. The normal ECG does not rule out that you don't have a heart disease. Even you do a ECG is normal at that present. You should wait for some time. Take one more ECG after 1 hour, because in a heart attack, the heart artery gets completely occluded. for first 1 hour, you don't get any changes in the ECG. So just don't be a very casual that my ECG is normal, nothing to worry. If you have got these symptoms, continued symptoms, your ECG is normal, wait for 1 hour, repeat ECG. If 2 repeated ECGs of 1 hour intervals are normal, then you can be assured that there is no heart disease. But if there are serial changes in the ECGs, you should think that your doctor should guide you about the further diseases. Then there is echocardiography, stress, and angiography. I will not explain you in detail, but interesting thing I'll show you that how we do a angiography, because everybody of us knows what is angiography, how we are doing angiography. This is a very old video. I shot it 11 years back, that is 10 years back, when we started a radial angiography. In this part of the country, people used to do angiography by the leg, so that patient has to stay in the hospital for 3 days. When I came here, I started a radial angiography. Radial angiography means angiography done by the hand. So what happens in a radial angiography is patient's admission time and discharge time is only 2 hours. So patient comes for angiography, we do angiography and we discharge them within 2 hours. That's how the radial angiography has changed the scenario in the cases of angiography. So this is an old video, 10 years back. So forgive me if some of the mishaps in the video here. But you will definitely will like to see how the angiography is done. This is a long video. We have to keep little. This is a mission hospital. I should tell, when I started my practice, I started in a mission hospital. This is a charitable hospital in Miras of 120 years old legacy or legacy history. So this is how patient enters into the cath lab, and these are the different people, that is cardiac technician and other people. So who is useful? You can see what we do is we first prepare the hand. Preparation of the hand means we take aseptic precautions and completely clean the hand. This is where you see a pulse. If everybody can palpate, you can feel a pulse on this side, that is near the thumb. This blood vessel, that is near the thumb, there is a blood vessel that is called as a radial artery. What we do is we put a catheter here in the radial artery. This whole artery, this hand artery is connected to a heart blood vessels. And so we go from here by putting a catheter into this artery, and from the hand we go into the heart, and there we inject the dye, and then we see it on an X-ray. This is the whole procedure of angiography. So the first step is the transradial puncture. I am palpating the pulse here. If you can see, it's a very, very small pulse, 1 millimeter pulse. This is the local anesthesia. We don't give a complete general anesthesia to the patient. It's just a local anesthesia at this site. The importance is when you do angiography through the leg, the artery size is almost 2.5 to 3 centimeters. But when we do angiography through the hand, the radial artery size is hardly 1 millimeter. And the problem here is, if you see, the puncturing this artery is very, very important. My needle should exactly go into the radial artery, right into the lumen of the radial artery, just by seeing and palpating. This is where the experience counts. I'm inserting this artery, this needle into the artery. I have inserted it. I am pulling it back. I'm pulling it back. Now you can see a blood coming here. That means my needle is into the artery. Then I put a small guide wire into the artery. That is a pulse. Then we insert a sheet. That is, this is a sheet. If you can see, This is a small sheet. This is a small tube which we insert into a radial artery. So this is a small sheet. This is a Japanese sheet. We call this as a thermoradial sheet. This is 0.3 millimeter internal diameter, external diameter of 6 millimeter sheet. You can see a blood. This is the injection, what we inject so that artery will not get hampered. Now our access is okay. We are already into the radial artery. We have given the blood thinners here. Now we'll take the catheter. That is the radial catheter or the JL catheters. I'll show you those catheters. So the whole access is ready. Now my cannula is into the blood vessel. This blood vessel is connected to the heart. You see, this is the catheter. This is called as the tiger catheter. The name of the catheter is tiger catheter. This catheter we insert into the artery. So the catheter is going inside the artery. The whole catheter now is traversing from the hand, from your shoulder, into the arm, into the, so now you can see here, I have inserted catheter into the blood vessels, that is the coronary vessels. I shown you those 3 vessels. Then I inject the dye in these coronary arteries. And once I inject the dye into this coronary artery, you can see this whole coronary artery visualized. This is the left-sided artery. There are 2 branches in the left side. This is a right-sided artery. So one is right-sided. There are 2 left-sided. So there are 3 coronary arteries which supply a blood vessel to the heart. And this is how we see what kind of blockages, where there are any blockages, whether it needs angioplasty or a bypass surgery. This is how we diagnose. Once we diagnose this whole procedure takes 5 minutes. This is a live procedure I am showing you. So the angiography, the moment patient came in and patient going out is all live. So it took me hardly 5 to 6 minutes. I take out the catheter once the procedure is over. These are called as the vacuum sheets. We inject the vacuum sheets here. So that bleeding will not happen. So once we hemostatize it, we will inflate this completely by the air and then take out the sheet. So there won't be any bleeding here. This is completely sealed. There is no bleeding. Patient gets up after the procedure. You can see this. Patient gets up after the procedure. So 5 minutes procedure and then patient walks out of the cath lab. This is the beauty of a radial angiography and angioplasty. That patient does not have to sleep for 3 days. He does not have to strain or nothing. So this is how we do a angiography. This is what we call as a angiography. So once we do an angiography, once we understand what are the blockage and all those things, we go for a angioplasty and bypass surgery. These are the different techniques. This is a short video which where I am showing you how we do a angioplasty. So what is it? As I told you, there are the blockages like this in the coronary artery. And in these blockages, what we do is we put a catheter across the heart. This catheter goes into the artery. From the artery, we cross this catheter across the blockages. And on this catheter, we cross the balloon. You see the balloon? Dilates the balloon and dilates the stent. This is the stent or the spring, what we called angioplasty, and we deploy this. And once we deploy this, we take it up. This procedure minded, it looks very simple, but it is very complicated. In the video, it is looking very simple. This is what we called as the angioplasty. Till now, I was talking about what is the heart disease, what are the different symptoms of the heart disease, how to diagnose the heart disease, how to do angiography, what are the different prevention methods, and what are the different treatment methods. But what I'm interested to talk to you is basically how to prevent this heart disease. We all know the heart disease is a very, very dangerous thing. 90%, 50% of them will die on a spot in this disease. So rather than developing a disease, what is important is to prevent the disease, that this disease should not happen. And that is very, very important part when we talk about the heart disease. So let's understand what are the risk factors, why we develop a heart disease, why we have this kind of the diseases in our body. Most important, this heart disease is divided into two parts. One, that is modified risk factors, and second is unmodifiable risk factors. So what are the unmodifiable risk factors? What are the natural risk factors? So age, that as the age advances, the age above 55, 60, we start getting the heart disease. So age is a non-modifiable heart risk factor for a heart disease. Second is the sex, that is you are male or female. The females has got the less chances of developing a heart disease before the menopause, that is before the age of 45, and the males has got a higher chances of developing a heart disease. But after the 45, both male and female will get the equal chances of developing the heart disease. And third is genetics. Most of the people come to me, sir, I don't smoke, I don't do alcohol, I don't take a very oily food, still I get the heart disease. Why? What is it? Why I am the chosen one? Because of your genetics. Some people, even you don't do anything, if your parents, your grandparents has got a disease, has a heart disease, will definitely, you will also have a heart disease. That is a genetic component of the heart disease. So this is unmodifiable part of the heart disease. Some are the modifiable. These are the unmodifiable. You can't change them. You can't change your age. You can't change your sex. You can't change your genetics. But what you can change, what you can control is diabetes. If you have a diabetes, you have got a higher chances of the heart disease. If you have got a blood pressure, you have got a higher chances. Obesity, your diet, your personality, that is also important of cause. So if you control your risk factors like diabetes, your diet, your obesity, the personalities, these things, if you try to control, you will definitely will have the less heart disease. These are called as the modifiable factors for the heart disease. So what we should do? What are the different factors which causes the heart disease and how we can prevent? So first important is your lifestyle. The lifestyle modification is the most important thing or the most important factor to prevent the heart disease. Second, your diet. Third, exercise. And fourth comes the preventive drugs or the preventive treatments. So these are the four important aspects when we talk about the prevention of the heart disease. So let's begin with the first, the lifestyle. Whenever we are born, we are come out of the mother's womb. For us, life is a pleasant journey. We don't think about anything else. We are just born. In childhood, we are so playful. We are so into a present moment. We don't have any fears. We don't have any much ambitions. We are very happy in whatever we are doing. So for us, life is a real pleasant journey. Moment we grow up, we are like, Hercules. We are taking whole earth on our head, and we try to think everything is important for me, everything is related to me, I must do this thing, I must do that thing, and the life starts getting complicated. We do so many day-to-day course for this lifestyle modification to maintaining our life. We are so much occupied in our day-to-day problems, issues, that there is a famous quote that he wants more and more and still more till he is no more. That's what we actually go into this mode. And then ambulances are with in your door the moment you start thinking about the more. So now the new research since last 5 to 6 years has emerged as heart disease is actually not the heart disease, but the heart disease is a mind disease. What you take into the mind, what you think into the mind, it comes to your heart. The heart is our wise men as anciently related heart to our brain or our emotions. And very truly, these emotions affect our heart. Whatever happens in our mind, whatever happens in our brain, definitely affects our heart and causes us the heart disease. This is what is important. I'll not go into these concepts, body, soul, and mind and intellect. What I am trying to tell you here is whatever you think, whatever you try to inculcate in your day-to-day habits because of your mind, that is what is going to cause you the heart disease. So just give a glimpse of the how the mind can affect your heart disease. I talk about the personality disorders and the relation with the heart disease. So in general, we divide human personality into type A, B, C, D. The first one is a type A personality. What is type A personality? The one who is very aggressive, the one who is very impulsive, restless, competitive, hurried, anxious, the one who wants to do everything on his own, one who is who thinks that whole I have got only one life and I have to do everything in this life, who competes with every small and step into every day-to-day life. These are all type A personalities, very anxious, very impulsive. The whole world belongs to them. They wants to do everything in their life. They keep worrying. They are restless. They want to conquer this world. These are all type A personalities. And my friends, the type A personality has got the maximum chance of having the heart disease, that is 60%. You don't smoke, don't do alcohol, you don't you exercise, you do a diet, everything, but you are a type A personality. Whatever you do, your chances of developing a heart disease are almost 60%. So you should not be a type A personality whenever you think about yourself. So just categorize yourself which kind of a personality you are. You should not be a type A. Then there is another kind of a people which are called as a type C personality. So what are these type C personalities are? These are all non-communicative. These are all depressed people. These are the one who thinks everything is going against me. I am a worthless, I'm a useless man on earth. I can't do anything. Everybody scolds me. Nobody helps me. These type of irritating behaviors, these type of depressing personalities are called as the type C personalities. And developing a heart disease, again, a 40% in these people, they are just go on sulking in everything they do. This is a type C personality. That is also equally problem. And the type D is a depressive personality, is a psychological disorder, which is the higher version of a type C personality, which are really depressed. They are dissatisfied. They are the one who really think the life is worthless, which actually needs a psychological treatment, psychological counseling, as well as the drugs. So these are the people who are also prone for developing a heart disease, and chances of developing of a heart disease in them is almost 40 to 50%. So you should not be a type A, you should not be a type C, you should not be a type D. Then what you should be? You should be a type B personality. So what is type B is be positive, be calm, be contented. Whatever you do, live in a moment, work in a moment, think about the moment, and then plan your work. Don't be a competitive, just compete with yourself. Take everything as it comes, take it positively, make the world around you positive. So these personalities are the type B personalities, and these kind of the personalities has got the chances of developing the heart disease only 10%. You see type A 60%, type B 10%. What's a cost difference? Most of the people come to me complaining, sir, my friend, he drinks, he smokes, he goes and dances around, he does whatever he wants to do, and still he doesn't have a heart disease. And I don't do anything, and I have a heart disease. my friend, this is what he is. He's a type B personality. I'm not telling that type B personality should take alcohol, smoke, and all those things. That is again the risk factors. But he is a jolly person. He is a happy person, and that's why he does not get the heart disease. And you are type A or a type C. That's why you develop a heart disease. So this is what is a behavioral change, what we need whenever we talk about the heart disease. And these behavioral changes are important whenever we are talking about the heart disease. So I just was talking one of the example how our lifestyle should be. The next important is diet. Diet becomes very, very important part of your lifestyle or your day-to-day activity. The 50% of our life issues are all related to diet. Then there are different varieties. In this short time, I can't explain you about the sattvic, karmic, rajas. There are different type of the diets which are important. But you can just imagine the moment you eat something very oily or something, your day is completely gone. The moment you are eating very light, you feel light, you think about the good things. So the diet makes very, very important change in your day-to-day activities. So always mind what you are eating. So what should be your diet, what you should eat? As important, whenever possible, always have the vegetarian diet. If you are not able to take a vegetarian diet, then it's okay. If you're a non-vegetarian diet, then in a non-vegetarian diet, we should avoid the red meat. Red meat is a mutton. The white meat is accepted. Fish is accepted. Eggs are accepted if you are a non-vegetarian. The important thing is, whatever you eat, make sure that you are eating a less cholesterol. Your oil should be having a less cholesterol oil. Whenever you plan a diet, in a diet there are three parts. One is carbohydrates, one is protein, and one is fat. Carbohydrates should be a 40% of your diet. Carbohydrate means chapati, then roti, rice. These are all carbohydrates. That should make a 40% of your meal. 30% of your meal should be a fat diet. That is, you can take oil, you can take dalda, to all those things, oil, whatever you want to eat. And then 30% of your food should be a protein diet. So protein, as it comes from the vegetables, it comes from the different sources of the eggs, it can come from the white meat. Those are the all proteins. So it should be always 40% of the carbohydrate, 30% of your protein, and remaining 10 to 20% should be your oil. This should be your diet. Diet should be rich in the fibers, much richer into the fibers, which controls the cholesterol. The fiber-rich diet like the green leafy vegetables, if you are eating like chia seeds, broccolis, all those things which gives you a higher contents of the fiber, we should eat those kind of the food. And most important in a diet is eat the fruits whichever available in that season and in that part of a country. The fruits are always made up of the issues. What thing are available in the fruits are the fruits which are present in that part season and that part of a country. So that suits your body. That is very, very important. That fruit should be eaten in this way. And then in a diet, important is to have the less cholesterol. Then third important thing is obesity. We should maintain the obesity levels as low as important. That is, it should be a BMI should be 24.9. That means, one simple example, for a 165 centimeter man, the weight should be 165 minus 100, that is 65. If your height is 179, your weight should be 179 minus 100, that is 79. So just keep this simple calculation and you should keep your weight in this range. So to keep the weight, what is important is, one is a diet, what you eat, and third important is exercise. So I'll just elaborate you what are the different kind of exercises what we can do. There are two kind of exercises. One is isotonic exercise and one is isometric exercise. what we should do, what kind of exercise? I get these questions very frequently. What kind of exercise we should do? So we should do always a isotonic exercise. So what is isotonic and what is isometric? Isotonic means running, cycling, yoga, swimming. These are all isotonic, which is, we also call them as a cardio. What is isometric is lifting the weights, making your muscles strong. These are the isometric exercises. Isometric exercises does not really help to your heart. 20 minutes a day, 5 days a week, you should do isotonic exercise. Either you run, either you do a cycling, either do a swimming, any kind of a cardio or the isotonic exercise is good for the heart. What it does is it dilates your peripheral arteries, it take out the load from the heart, it clears off your arteries, make the arteries clear of atherosclerosis, and builds up the good hormones in your body, which in turn affects the overall well-being of the body. So always do a isotonic exercise whenever you are thinking about the exercise, and add it with the isometric exercise. There are different types of the exercise. You require a different class for exercise actually. Now we should understand for now that isotonic is important for a heart. And last but not least is smoking, tobacco, in whichever form it is. You should not chew tobacco, you should not BD, you should not take the cigarette. Whatever form tobacco is very, very, very harmful. This is very important when we talk about the heart disease. We call 3S are very important when we talk about the heart disease. The 3S are smoking, sitting, and sugar. These are the 3 enemies of the heart. Sugar is one enemy, sitting is another enemy, and smoking is the most dangerous enemy of the heart. 70% of the smokers get very, very bad heart disease and the very bad coronaries. Out of those 70%, not only the heart, but 50% of them will have a kidney disease, will have the peripheral vascular diseases, will have the wounds all over the body. And this is what is going to happen at the end of 10 to 20 years when you smoke. Every cigarette you smoke takes out your life by at least 1 hour. And as frequency increases, it takes out your life by 10 to 15 years in the run. So some people come to me, say that I smoke only 1 cigarette per day. Is it okay? It's not okay. Even you smoke 1 cigarette or you smoke a packets of cigarettes, it is going to harm your body at very, very high cost. So it is a very dangerous thing to do, and we should all quit smoking. This is what is very important. So I'll conclude my talk by saying that what we should do to prevent the heart disease is most important is change in a lifestyle. Decrease your obesity, do your right diet arrangements, reduce your salt intake, do a good exercise, that is isotonic exercise. Smoking is not at all, and try to be a type B personality. Try to calm yourself, try to be in a moment, and that's how you are going to change your life. And that is how you are going to prevent our heart disease. So again, I'll emphasize the point that the heart disease is not a heart disease, but heart disease is a mind disease, and control your mind and control your heart. Thank you very much for the patient listening.
Excellent, sir. Excellent. Very nice. Okay, sir. Now you can stop the screen, sir. Stop sharing the screen.
Yeah.
Okay, so Rahul, sir, if there are some questions, you can, dear friends, you can type the questions. Don't ask the questions. Type the questions to Rahul, sir, if you have any questions. And before you type, let me ask this question to sir. Sir, then who should go for a checkup? I mean, preventive checkup. What is the age criteria? Is it above any particular age?
So preventive criteria at present is above the age of 45, non-diabetic, non-hypertensive, no risk factors. All those people should go yearly checkups. The yearly checkups is cholesterol once in a year, thyroid checkup once in a year, and treadmill and echo once in a year at the above the age of 45. This is what is recommended. And the patient who has already suffered a heart disease has to undergo a coronary CT angio every 5 years.
Okay.
Sir, here first question is there. Increasing cases in early 30s. What would be the reason for this?
Increasing?
Cases in early 30s.
Yes, this is a very important part because yesterday only I treated a patient of a 22 years old of the heart disease who had 3 blockages in the heart. And I keep getting these kind of the patients, at least 10 to 12 patients every month, that they are in between 20 to 35 years of age. And I'm seeing this trend since last 5 to 6 years. 10 years back, that this was not a trend in a heart disease. But now what is happening is the stress, as I mentioned in my topic, that is personality. The stress of the day to day is increasing so much that it is hampering this millennium generation, which is there at present. They are so competitive. They're all type A personalities. This is the one thing which is increasing the heart disease incidences in this. And second, the habits. Most of them, what I came across, are smokers, are some form of a tobacco chewers. And third is no exercise, sitting in most of the times in front of the computers, and the whole gamut of diet, about the exercise and the lifestyle. These 3 important things are all hampered in these cases, and that's why they are coming.
Yeah.
Dr. Jahangir is asking one question, Rahul sir. Take that question.
Who, sir?
Dentist Dr.
Yeah.
Jahangir.
Yeah. I'm taking that question. How to differentiate between cardiac pain and gastric pain?
Yeah, it's very important question. There are 2 things how to differentiate between the gastric pain and the cardiac pain. Number 1, the cardiac pain is always exertional pain. That means the pain which is more on exertion. The moment you walk, moment you work something, you do some work, that pain increases. That is called as angina, anginal pain. The gastric pain is not the exertional pain. The pain is also on a rest. Pain is also on a sitting. The same kind of a pain, if you start walking, the intensity of a pain remains same. Number 1. Number 2, the gastric pain is always associated with regurgitation or a watering of the mouth. Most of the things we say, there is a retrosternal burning, in Marathi jal hote, and then I get a watering of the mouth. So watering of the mouth and burning pain, retrosternal pain, which does not increases on exertion, is a gastric pain. The pain which increases with the exertion, and which is a typical explained, as I explained, the anginal pain, that somebody is sitting on your head, choking your neck, that kind of a pain, and which increases on exertion, is always a cardiac pain.
Another question, sir. What are the signs of an unhealthy heart?
Signs of unhealthy heart.
Yeah.
Yeah, signs of an unhealthy heart. The number 1 sign of unhealthy heart is the symptoms of chest pain, symptoms of the breathlessness. You are not able to do a right exercise. The moment you do exercise, you get a breathless. Your blood vessels are not coping with the oxygen and the blood requirements of the body. This is the first important thing when we talk about the unhealthy heart. And unhealthy heart is very difficult to diagnose. You can diagnose a diseased heart, but unhealthy heart will be only diagnosed after you get a disease. So this is how it is. So there is no way how we diagnose unhealthy heart. For that, preventive checkups are important. Till it get disease, it does not give you symptoms.
Yeah. Another question, sir. Can you brief how diabetic is related to heart disease?
Yes, diabetic is a metabolic syndrome. What is metabolic syndrome is, in a diabetes, the sugar levels are very high in the body. And these high sugar levels are also associated with the high cholesterol levels. And because of that, your liver function is hampered in a diabetic patients. And as this liver function is hampered in the diabetic patients, whatever cholesterol we eat is not exerted from the body. It goes on accumulating onto the arteries of the heart, arteries of the brain, and the legs, and that causes the more symptoms or the more blockages in the body. So only thing is we should control our sugars below 160, 180 and HbA1c of less than 5.7. This is the only way we can control the heart disease.
Yeah. Whenever someone gets heart attack, what is the first aid we can do before reaching to hospital?
Yes, a very important question. That the first aid, we should always keep two tablets, that is antiplatelets, ecosprin and clopidogrel. That should be kept in your first aid box into the heart, whether it is a heart disease or not heart disease. You suspect a heart disease, you give these two tablets to a patient, 325 milligram of ecosprin and 600 milligram of clopidogrel. Everybody should nowadays keep this tablet in your primary aid, first aid box, and immediately give these tablets. Why? Because giving antiplatelets within 1 hour of the heart attack reduces the chances of heart attack by more than 50%. So this is what is a scientifically proven fact. So if you reach before before reaching to the hospital, if you give these drugs, the chances of going into a severe heart attack will be prevented. This is number one. Number two, if the heart disease actually affected you, the patient is in agonizing pain, patient is completely pulseless, completely breathless, we should do a CPR. The CPR technique is a different technique. Generally, if you go on a YouTube or something, you will get to know what is CPR technique. We also teach CPR technique to the masses. That is very important, that you should compress your chest walls, you should give the breaths, and then till you reach to the hospital, you should keep this artificial pumping on if the patient is unconscious.
They are asking you to type the name of those two tablets.
Yeah.
Ecosprin,
Ecosprin and glutamine, I think.
I'll type that.
Yeah. Another question is this, sir. Eating garlic, how it will help to prevent heart attack?
Eating garlic is one of the Ayurvedic medicine. I'll just type this and answer the question.
Yes.
Yes, sir.
So garlic is mentioned into the Ayurveda as a heart protective tablet. It is for a chronic heart disease. If you eat one garlic per day, there is an element in a garlic which affects the progression of the atherosclerosis. That is, formation of the plaques are reduced by eating one garlic a day. This has been mentioned in Ayurveda and this has been proven. Means it's not the therapy which actually are propagated one. It is the real therapy which really helps, that it prevents the progression of atherosclerosis and progression of the plaques.
Yeah. How to reduce the cholesterol which is already in the veins, already deposited?
How to reduce is, as I told you, the most important is diet. You do a reverse diet, the cholesterol part will be reduced. Then you do exercise, aerobic exercises, isotonic exercises. The first one to go from your body is the fat which is stored into the muscle. Next to go from your body is the abdominal fat, the belly fat, what we call. After the belly fat has gone, third one is to go is the cholesterol which is accumulated into the blood vessels. So your exercise levels are now so high, so that whole that cholesterol should be washed away by this kind of exercises, isotonic exercise.
Yeah.
Okay, guys, last question. We will stop then.
Last question, sir. How pranayama will help? Is it helpful to do pranayama for heart disease?
As I told you now, the heart disease is shifted a concept from a heart disease to a mind disease. So now it is no more a heart disease, it is a mind disease. And what pranayama actually does is, see, when you do a pranayama, when you do a dhyan, what happens is you try to concentrate on one point in your head, or you concentrate on a breathing, whatever you are doing. By doing this, your mind becomes calm. if you practice this, you start remaining into the present situation, into a moment, the same moment. You try to enjoy that moment and you start remaining in that moment. What happens with this? There are good hormones and bad hormones. The moment you achieve this state, the good hormones called as the endorphin 1 and endorphin 3 will be released in your body. And these hormones actually dilates all the vessels into the body. After a pranayama, after attending that small, dhyana, you can experience that calmness in your head as well as your body becomes warm. Warm body means your whole blood vessel dilates. After this pranayama, whole blood vessels into the coronaries, that means blood vessels of the heart as well as the body gets dilated. Good hormones are secreted. These hormones reduces the atherosclerosis. These hormones reduces the toxins in your body. These hormones makes your blood vessels to dilate, increases the capacity of these blood vessels, and that's the way they help you. That's why the pranayama and yogasana is needed in everyday practice when you go ahead.
Yes, sir. Thank you very much.
Sir, we haven't received the name of the tablets yet. Or have you typed it? Have you typed it, sir?
Yeah, I have typed it. Clopidogrel here. Ecospin.
All of you got it? All of you got it? I haven't seen.
No,
No, sir.
no, sir.
Just see where it is. Just see the option, everyone. In the chat, everyone option is there.
I'll again write that name.
Yes.
Now it appears. No
Kaushik
problem.
has done that.
Yeah,
Kaushik.
yes.
I think Kaushik has done that. Clopidogrel and ecosprin.
Clopidogrel.
Clopidogrel 75 and Ecosprin 325, right, sir?
Yes.
Yeah, great. Okay. And these tablets must be there with everyone, and they should take one tablet each when they feel like in symptoms of angina pain, right, sir?
Yes. Yes.
Yeah, great, sir. Great. Very nice. Well, sir, one of the best sessions we had here and one of the most helpful sessions. And I'd like to thank you from the bottom of my heart, sir. Sir, in my institute, what I do is I try to give these people the best I can. And today, even initially, I was quite skeptical to ask you because you are so busy and handling so many hospitals together. I was like, whether you will get the time or not, because a heart surgeon doctor is always on the go. But thanks a lot for giving your time, dear friends. All of you, please thanks, sir, because out of his busy schedule nowadays, very few people do this, and he has accepted my invitation and given his valuable time for us. Sir, thanks a lot again from everyone. And I'm happy that this session will help someone to cure, to prevent any death and live a healthy and better life. But one good thing, sir, you told that I have a bright future. That is, mind is very important. So my career is very bright in the future. So you have to work on your mind. I always tell you. Now a specialist is telling you, friends. So work on your psychology. I always tell. I told you, work on your pranayama. I always tell. So now your expert is telling you, you have to follow that. Thanks a lot, sir, for coming here. And I thank you for your valuable time.
Thank you very much. Thank you very
Thanks a
much.
lot, sir.
Thank you very much, sir.
Thank you so much, sir.
Thank you, sir.
Thank you.
Thank you, sir. Thank you.
Thank you, sir.